law does not get at the high-level drug kingpin or the person who knows what's in an illicit substance, even if that's the stated intention. Additionally, illicit substances go through so many different hands in a black market, it's hard to know who to hold culpable for such a tragedy. Secondly, many people who die of an overdose have multiple substances in their body, and likely the death is due to the combination of these different substances. Yet a drug user can face an up-to-life prison sentence for distributing a substance to a friend that may have only been a small part of their death. This law uses a blunt instrument when we should be using a scalpel. Finally, we know, based on decades of criminal justice-based drug policy, that harsher penalties do not decrease drug-using activity. So this bill's disturbing message will not decrease drug use or drug sales, but will further marginalize people who use drugs and increase their fears to ask for help. This law will have a chilling effect on the community, who will be terrified to call 911 in the moment of paralyzing crisis for fear of a life sentence, even if technically there are stated provisions in the law. We urge our elected officials to listen to the experience, expertise, and wisdom of the medical, public health, and recovery communities. Please listen to those who are on the front lines of this overdose epidemic and those who have personal experience with substance use disorder themselves. While we commend the improvements that have been made to improve the bill through amendments, the current version is still very harmful. We are asking to be included around the table to work towards policies and practices that prioritize the lives of Rhode Islanders and keep people alive. While this is about Christian's law, it's also about the much bigger topic of the approach we take to this horrible epidemic. We are at a critical crossroads in deciding if we want to take a public health or a criminal justice approach to address overdoses. Rhode Island, and specifically Governor Raimondo, have been leaders of taking effective public health approaches and understanding that addiction is a disease. Rhode Island was one of the few states that saw a decrease in overdose deaths last year, and that's huge. While we have really far to go, we are so grateful for the governor's efforts to increase access to tools that keep people alive, like naloxone, and also like treatment. We're proud to be from Rhode Island, where people look towards us as an example of a state that's leading the efforts to address overdoses and also around criminal justice reinvestment. We worry that the approach of further criminalization, such as through Christian's law, will detract and take a step back from the important public health work we are doing. It's sending the wrong message. As was discussed in the over 50 minutes of debate on the Senate floor about Christian's law, we need to rethink our approach to this epidemic because what we have been doing for decades is not working, and we cannot continue doing more of the same. Simply too many people are dying. We need to be working towards supportive systems that actively work to improve our communities and keep people alive, rather than throwing people away in prison out of blame and revenge. Use of a public health approach, not lengthy criminal sentences, for users and small-time dealers is essential to keep making headway on this crisis. Governor Raimondo and members of the House of Representatives, we urge you again to listen to the experience and expertise of medical professionals, public health experts, and people in the recovery community. Governor Raimondo, if this bill crosses your desk, we're asking that you'll stand with the medical community, with public health professionals, with people with lived experience, and please veto it. We look forward to continuing to support your innovative and effective efforts to stop this epidemic through public health interventions. Thank you so much.